All right, let's go ahead and get started. Thank you everyone for joining today. We are so excited to kick off the 2025 Sarcoma Exchange brought to you by the Sarcoma Alliance and Wendy Walk and sponsored by Genentech, Ipsen, and Adaptimmune. My name's Julie Johnson. I'm a fellow sarcoma survivor and board member of the Sarcoma Alliance. I will be co-hosting today's discussion with Meredith Berger, patient coordinator at Wendy Walk. I'd also like to recognize Tim Opsel, a fellow board member of the Sarcoma Alliance, who is running the technical components of today's programming. We are so glad you're here, and we're looking forward to a great day of connecting, learning, and sharing. You can go ahead and move to the next slide. We've got a robust agenda ahead of us over the next 3.5, 4 hours, so make yourself comfortable. We will be hearing from speakers who bring a wide range of expertise. So we have sarcoma specialists, oncology advocates, and even back for a second year by popular demand, our peer panel. We have curated today's content to really focus on one theme, and that is helping all sarcoma patients, regardless of subtype, build the skills and confidence to better advocate for ourselves and our care. So I wanted to just take a quick moment to share a personal story that served as the inspiration for today's theme and for our eventual content. So I mentioned earlier that sarcoma is really personal to me. I was diagnosed with undifferentiated pleomorphic sarcoma in 2019. My case was very complex from the beginning. And at my first appointment with my radiation oncologist, we met, and he was walking me through several different treatment options that were available. And I listened, and when he finished, I kind of sat there and I asked, and many of you maybe have been in a similar situation, but I said, okay, so these all sound like reasonable options. What do I do? And he said something that at the time maybe made me a bit upset, and now is something that I'll never forget and something that I often pass on to other patients who are newly diagnosed when I speak to them. He told me, my job as your physician is to give you the options and to lay out risks and benefits associated with those options. And then he said something profound. He said, but you are the CEO of your care team. So we as the physician team are here to guide you and to give you the best options we can. But ultimately, the decisions are yours. I don't know if anybody's ever said anything like that to any of you before, but I'll be honest, at the time, it didn't really sit well with me. I was newly diagnosed. I was scared. I was unsure what to do. I was not feeling like a CEO. Together with him, I was able to make a decision that felt like the right decision for me at the time. Was it the right decision? I don't know, but I do know that it was the right decision based on the information and knowledge that I had available to me at the time. And sometimes in the sarcoma world, that is the best you can do. But 6 years later and countless opportunities to build that skill set, I understand what he meant. The truth is that no one lives in our bodies except us. No one knows our values and our boundaries the way that we do. So while being at the center of our care can feel certainly intimidating, it can also feel empowering once we get our footing. So that's why we're hosting programs like this. That's why we put time and effort into the exchange every year, because these conversations that we have today, the resources, the connections, and the community are here to help you as you manage your care. So let's get started with today's exchange. We have a few housekeeping details before we start. As all of you know, this is a Zoom meeting, specifically a Zoom webinar. So by default, everyone will be muted and screen sharing will not be permitted. But there are some things that we do encourage. So at the bottom of your screen, there should be a chat feature. Please use the chat feature for basic introductions, to say hello, any comment where you'd like to chat back and forth with other patients or caregivers. That information or those types of comments can happen in that in the chat feature. Yes. So hi from Canada. Thanks, Casey, for kicking us off with that. A second way that we would love for you to communicate is through the Q&A feature. So we will ask that as the speakers are speaking, we do want to hear questions that you have. Each of the speakers, time permitting, will have time to answer some of these questions. Some might be answered live, some might be answered just through replies in the Q&A feature. But if you've got a question about something a speaker is talking about, maybe a speaker stressed the importance of getting your medical records, that a question like that would go into the Q&A so that a speaker can address it. So again, we'll attempt to have a Q&A at the end of each session, time permitting. But please remember, we are not here and we are not able to answer questions specific to your case. So if you're going to ask a question, please word it in a way that is general. And with that, I would like to introduce Philip Leiter, who is president of the Sarcoma Alliance, for today's opening remarks. Tim, I think you can move to the next slide. So Philip has a very personal connection to the sarcoma community. His sister, Suzanne Leiter, had a vision over 25 years ago for a space where people affected by sarcoma could come for support, information, and for a sense of community. Her vision has since become the Sarcoma Alliance. And Philip has played an integral role in shaping the Alliance into the organization that it is today. So with that, please welcome Philip Leiter.
Thank you so much, Julie. Next slide, please, Tim. I want to welcome everybody to our 8th annual Sarcoma Exchange. It is a great honor and a pleasure to have you all here. And I'm president of the board of directors of the Sarcoma Alliance. And on behalf of the board of directors, I want to welcome you as well. Next slide, please. The mission of the Sarcoma Alliance is to improve the lives of people affected by sarcoma through accurate diagnosis, improved access to care, guidance, education, and support. Next slide. As Julie mentioned, our inspiration is my sister, Suzanne Leiter. She was a registered nurse and a synovial sarcoma patient, and she founded the organization in 1999. Suzanne wanted to ensure that no one suffers from sarcoma alone, that everyone receives accurate and reliable information, and that all sarcoma patients have the opportunity to seek expert sarcoma care. Next slide, please. Next slide after that, sorry. So our programs, I'll focus on 2 for now and then mention the rest. The first one is a fund that we have in my sister's memory. It's the Suzanne Renee Leiter Memorial Assistance Fund. And we provide limited grants. They're currently $1,000 to reimburse people for expenses they incur in getting a second medical opinion from a sarcoma expert. You can go to our website and learn more about the program. It's currently on a reimbursement basis. So if you've had a second opinion consultation, you're still eligible for the grant. You can apply. It doesn't have to be before the consultation. It can be afterwards. And then the second major program that we're participating in today is the Sarcoma Exchange, which was intended to do a number of things that I'll talk about in the next slide. But there are a host of other programs we have, and very importantly, our website, www.sarcomaalliance.org. I hope you all will visit the website. It includes a host of other programs we put on, including support groups, peer-to-peer mentoring. We have patient navigation, and Meredith of Wendy Walk also partners with us on that. We have a series of social media that trumpets things to the world. We have a newsletter, generally quarterly, that does the same. And then we have the medical advisory board that includes some of the top names in medical care for people with sarcoma in the world. Next slide, please. So what is the Sarcoma Exchange? This program brings people affected by sarcoma together. It was originally an in-person conference, but after the COVID pandemic, we started doing it virtually, and people liked it that way. So we had a 2-day program for a couple of years. It got to be a very long program. And after seeing the feedback from folks, they loved all the substance. They loved the inspiration behind the exchange, but they wanted to see us break it up a little bit. So what we're doing now is we have a day like today during Sarcoma Awareness Week, where we do a very substantive program. And then we're going to have a series of webinars throughout the year that are going to be part of our Sarcoma Exchange series. And for now, they're going to focus on sarcoma subtypes and really do a deep dive into each sarcoma subtype. And then various topics of interest that should help people throughout the year with things that we bring up at our Sarcoma Exchange and Sarcoma Awareness Month and at some of the webinars. The videos to our webinars, including this Sarcoma Exchange, will be preserved on our YouTube page. So if you don't take notes like Julie said, or you miss something, you can always go back afterwards and watch the whole program on YouTube. And all of our webinars will be posted to YouTube. It'll take a couple weeks for us to edit the content and post it online, but we'll let you know if you registered. We'll let you know by email when the content is ready to view. Next slide, please. I want to just thank the people that made this year's event happen. They are workhorses and tremendous people with an amazing heart. First and foremost, Julie, who's already spoken to, Julie Johnson, who has really driven the program for these past 2 years. And Meredith Berger, who's been her partner and really helped move this program into the place that it is now. And we're joined this year by Tim Opsahl, who is helping out with our technical side of things, which is very important because I'm a complete Zoom neophyte, and we really needed somebody who knew what they were doing, and Tim is that guy. Next slide, please. The other people I want to thank, of course, for this are our sponsors, Ipsen, Adaptimmune, and Genentech. Without their support, the Sarcoma Exchange would not be a possibility. Thank you, everybody. Thank you, Wendy Walk. Thank you, everybody at the Sarcoma Alliance. And with that, thank you for joining us for this event.
At the Alliance, we also believe that our peers can be some of our most powerful mentors. I work closely with patients I meet through the Alliance, as well as in my role as patient care coordinator at Wendy Walk. Today, I have 4 amazing and inspiring people to introduce you to for our patient caregiver panel. Both Zachary and Michelle are patients I met through different sarcoma Facebook groups about 2 years ago. Fida, also a patient, and Natasha, a caregiver I met pretty recently through the Sarcoma Alliance. We're going to start with quick intros, so the patients, caregivers will share a little bit about their diagnosis, where they were treated, where they currently are with their sarcoma at this point. And then I have one prepared question for each of the panelists. You can put any questions in the Q&A, and if there's time, we'll address them. So Zach, why don't you get us started with just a little 1-minute intro?
You can hear me all right?
Yes.
Perfect. So, hi everybody. My name is Zachary Spieshak. I was diagnosed with monophasic synovial sarcoma, stage 3B in my right hand, May of 2023. I underwent isolated limb perfusion in Prague, Czech Republic. I did 6 rounds of Ames chemotherapy treatment and 25 rounds of radiotherapy prior to my surgery. I'm being seen and treated by Dr. Edward Athanasian at Memorial Sloan Kettering Cancer Center in New York, and I've been 1 year and 6 months cancer free. I'm going to be in surveillance mode for 5 to 10 years to ensure that there is no reoccurrence in either my chest or extremities by both Dr. A and my oncology team.
Thanks so much, Zach. Okay, next we have Michelle. Oh, we're changing our view. Here we go.
Oh,
We're
okay.
getting fancy.
Hi, everyone. I'm Michelle Posen. I was originally diagnosed with liposarcoma in 2008. Prior to that, I was a cancer patient advocate for almost 13 years, working at 3 different organizations. I worked on a radio talk show for cancer patients for 10 years, and then a pharmaceutical company and another nonprofit. I could say I was educated before my own diagnosis, but obviously it was still a shock. I had an 18-month-old at home, and yeah, it was in my right femur. I had a couple rounds of AIM in the hospital before, and a few rounds of radiation before my surgery. I only had 40% cell death of the tumor. I just thought they were going to just take out the tumor and it would be super easy, but I didn't realize the tumor was like 17 centimeters and wrapped around my quadricep muscles and laying on my femur bone. So they took that out, and I relearned to walk and did another 1.5 years of AIM just for extra security, and 10 to 20% chance of non-reoccurrence. Just that extra boost I thought was important. October of 2022, when I met Meredith, I was diagnosed again. This time was with radiation-induced sarcoma. My femur broke out of the blue, and found out I had this new sarcoma inside the bone this time, and had major reconstruction and metal and knee replacement and the whole 9 yards, and did 4 rounds of AIM in the hospital. And then a year later, we found out it was back, and I tried to do 3 months of immunotherapy, and we realized that that wasn't working, and the tumors were growing, and because of the prior surgeries, there wasn't much left to do with my leg, and my leg wouldn't have been, if they had done surgery and taken out the tumors, my leg wouldn't have been usable. So we decided to amputate in January. So I'm currently living and adjusting with that. It was a hip articulation, excuse me. And so they took everything, they took the hip joint all the way down just to make sure that the whole radiation field was covered. So, but I'm here, and happy to be here and happy to participate today. And so thank you so much.
Thank you, Michelle. Okay, Fida, you're up. Oh, we don't hear you. You're muted.
Sorry about that.
Oh, okay. Hi, Fida.
Go ahead.
No, you're good. You're good.
Okay. So the question was, how. Go ahead.
Oh, no. Oh, sorry. We're just doing like a quick little intro right now. So you could just like where you are with your sarcoma, just whatever you want to share, just like a quick little 1-minute thing, and then we'll go through to questions. Thanks.
Okay, so my name is Fida. I'm in California, Northern California, and I'm pretty new to this. This is I was officially diagnosed in March, but this whole thing had started somewhere in last September of 2024. So I was diagnosed with a epithelioid sarcoma in my left pinky finger, of all places, and so where I'm at right now is I have a partial amputation scheduled for tomorrow, as well as a sentinel node biopsy at the same time. So they're doing both. They're also doing an extra, they called me today, an extra scan, an extra like nuclear scan in the morning. So that's where I'm at right now.
Thank you so much for being here today, especially with all you have going on. Okay.
Thank you.
Yeah. Natasha.
Hi everybody, I'm Natasha Serrano. I am the caregiver of a young boy, also diagnosed with epithelioid sarcoma. We've been on this journey for 5 years. He was first diagnosed at the age of 8 with a sarcoma in the webbing between his left thumb and left forefinger. And so now at this point, he's doing well. But I'm one of those folks that Dr. P, I can't remember her last name, Dr. P said, some people feel like they really need to continue to use their voice to help advocate for the community. And that's me. So I bring the perspective of a parent. I've had to navigate some difficult decisions. Had to push for others and for answers, excuse me, in the face of uncertainty. So I try to take that experience and bring it forward to help others when they have to go through those same situations as well.
That's great. Thank you so much, Natasha. Okay, so we're going to go back to Zach, and the question that I gave to him to think about and answer was, what resources, so people, tools, communities, etc., helped you become a stronger self-advocate?
So I think definitely the biggest resource that was able to help me become my own self-advocate was my doctors, my own self-awareness, and obviously the entire community of people around me. Even starting the journey, my doctor works closely with Europe for treatments that aren't available here in the United States. I was told I was going to lose my hand and my fingers, and my doctor worked with a team of specialists in Europe to see if isolated limb perfusion would be an option for me, and it was. So my doctor sent me to Europe to get isolated limb perfusion, which is really used tumor necrosis factor alpha, which is known as baromum, which is an existential chemotherapy drug that was found to kill people in the 70s. And they injected it into my hand and were able to zap the tumor so that I could come back here and then get the proper treatment to help give me a possibility of keeping my hand. I wouldn't have had my hand today, I believe, if it wasn't for that and my doctor pushing for that and advocating for it. And he was very close with an organization called Middle Finger to Cancer, which connected to me, which is where I also met Make a Wish, Wendy Walk, and I also met Cures Kids, which are the other organizations that have been there and worked with me to be able to get outreach to find people that have cancers that are similar to mine. It's every possibility when it comes to cancer being in the hand seems to be 1 in a million on top of whatever the possibility is. And to be able to find people that I could connect to really helped me get through my journey. I can't look anything up. I can't find any research. The doctors in Europe found that my high bifurcation, which is when I have 2 arteries up in my shoulder versus where they split in the elbow, I was a case study for all of Europe for isolated limb perfusions going forward for more patients. So it was a really scary journey, but I would say my doctor was my biggest advocate. He always said that if it was his kids, he would do the same thing. And that really touched me because to go through everything without any backbone, I needed something to stand on. And him being there for me was everything. So I'd say that was my biggest advocacy when it came to fighting my sarcoma.
That's great. Thank you so much for that. And so this organization, it was really your doctor putting you in touch with this organization. And one thing I just want to let people know is they I think fully funded you to travel.
Yes.
Yeah, which is amazing. So yeah, I mean, your story just really touched me. And I just thought of it now. It's like we've got 3 people. When my son had cancer, sarcoma in his hand, I was told how rare it is, right? And now anytime a doctor says anything's rare to me, anyone in my family, it's like, don't tell me something's rare, right? And so we've got 3 people here of, like your son, Natasha, Fida, and now, Zach with the hand. So, and I'm not saying it's not rare, but right, when it happens to you and then you meet other people. Yeah. Well, thank you so much for sharing that. And then, yeah.
No, thank you.
Yeah, thanks a lot. I appreciate it. Okay, Michelle. So for Michelle, I kind of know the answer to this. Did you ever feel overwhelmed by options? How did you find clarity
Sure.
and make informed decisions? Because I think sarcoma in general can be very
Yeah.
overwhelming. So
So when I was first diagnosed, I was pregnant with our second child, and I basically had to make a decision. Do I fight for my life, or do I continue with the pregnancy and then fight for my life? And I didn't want to leave my husband with two small children. I was worried about that. So I had to make that difficult decision. But so that was an overwhelming situation. And obviously, and really before my tush was even in the seat, I was seen and treated at UCLA. The doctor was telling me I had sarcoma. You know, he put up my scans up on the screen, and like before my butt was even in the seat, I learned I had sarcoma. So each phase of this has been obviously overwhelming, different opinions. I went to different, a few different doctors. Fortunately, living here in Los Angeles, there are several cancer centers that do treat sarcoma. And basically they all told me, well, we were all in your panel and tumor board, and we're all kind of in agreement. So that was really helpful. I did put a lot of faith in the doctors. I just kind of put my head down and went forward, and I'm like, I'm going to do everything I can to stay here and be able to watch my daughter grow up. And she's starting college in the fall, so I'm just super grateful for modern technology and medicine. And basically I relied on support and community in terms of any medical decisions. That was between me and my husband, and he was my biggest advocate in terms of doing a lot of research. I never looked at the percentages. I didn't look at, I knew I had a rare cancer because when I looked it up, it was hard for me to find anyone alive with this disease at the time. This is 2008. There wasn't all these chat groups online, and there wasn't as much availability. And because of my prior experience being an advocate, I spoke up with the doctors. I'm like, can't you guys send me a patient to talk to? I need to know that people live with this disease. I need to know people are thriving with this disease. And eventually they found me a couple of people. And since then, I've definitely met others with my same situation, and actually just hosted an event last week, and someone with the same cancer, same doctors. I wish I knew her 16, 17 years ago, but grateful to know her now. And I think the world has changed so much for the better in terms of resources and support and information, obviously, thanks to the Alliance and all the work that's being done here. But I really just, what do I need to do to stick around is basically was my question. And
yeah.
I believed, I listened to my doctors. We have a few doctors. I have oncologists in my realm. And we just started asking people when this most recent decision to amputate came up. I just figured I didn't think I had it in me to do more chemotherapy that might not work, or do more immunotherapy that might not work. So, and I didn't want to put myself at risk for metastasis. So just kind of made those deductions through all the information, and that's just kind of where we're at right now. So I just the overwhelming. I even took myself I took myself across the country to see my original doctor, just to get a second opinion, and either via email or in person. All the doctors were saying the same thing. So I kind of just I went with my gut and with the medical opinions. So that's what helped.
No, that's great. Thanks for sharing that. And I know, because I was thinking like,
Yeah.
Making a decision like an amputation, your type of amputation is such a big decision,
Yeah.
but the way you explained it, it's like, I think it's these, when we say like, well, everything's
Excuse me.
right? It's like, what did you say?
Oh, nothing. Oh,
Oh,
my doctors told me I was a one of one, like the N
Yeah.
of one. I'm like, well, what am I
Yeah.
supposed to do with that? That
Yeah.
doesn't help. Like, just
Yeah.
Yeah.
but it sounds like you thought it all through, and that's the best that we can do, as patients, as caregivers, all of that. Yeah. Well, thank you for sharing that.
Absolutely.
I really appreciate it.
Yeah.
Okay, Fida, can you describe a moment in your sarcoma cancer journey when you had to advocate for yourself in a way that changed your care? Oh, you're muted.
Always muted, sorry. Okay, so my situation was a little bit unique because by the time I had been diagnosed, they had already tried to take out what they thought was completely something else out of my hand. And what had happened is I have Kaiser, so it's kind of an all-in-one. You don't really just get to say, hey, I want to go to this doctor. You kind of have to jump through all of their hoops. And so it started with a dermatologist. And then, they were like, oh, well, we don't know what to do. We're going to send you to plastic surgery. And plastic surgery was like, well, we don't know what it is, but we're going to take it out. So the plastic surgeon ended up taking out what looked like a BB out of my finger and didn't know what it was. So they sent it out to labs. And then that's when I got the diagnosis. And then they had scheduled the same plastic surgeon to do the amputation. After I talked to the panel and all of the oncologists, they said, the best thing to do is a partial amputation. So I said, okay. But they scheduled for the plastic surgeon to do it. And so for about a month, I kept going back and forth with the plastic surgeon and the orthopedic surgeon. And they're different Kaisers and they don't speak to each other. And so I had to kind of keep asking for more and more and more. They didn't want to do an MRI. They didn't want to do a CT scan of my chest. They didn't want to do a sentinel node biopsy. They didn't want to do all of these things until I had to push and push and push. And at the end of the day, the orthopedic surgeon finally messaged me and said, you know what, how about I'll just do the surgery? Because the plastic surgeon was going to do a partial amputation and then see how it goes and see if we need more. And I said, no, I'm not doing this twice. So I can't remember what it was called when they do it layer by layer to make sure that there's no negative margins.
And so through the pathologist, right?
Correct. Yeah. So
Like
the plastic surgeon was not going to have the pathology going at the same time. And so I had to keep pushing and pushing until the orthopedic surgeon agreed to do it, and then also agreed to do it in the way that I want it done, having both the amputation, the pathology, and the sentinel node biopsy going at the same time. So it was hard. It took a lot. Meredith was actually with me on a lot of this.
Yeah. So. I think it was really, amazing to see, because I didn't have that much experience with Kaiser, and and ideally, as much as we say we want to be an advocate and all of that, we do want to feel that our doctors are doing everything right. And so Fida did do a second opinion with City of Hope virtually, and basically we used that information and went back to Kaiser and just requested things. And so it's something that you can do. Is it ideal? Maybe not, right? But if that's your insurance and that's what you're staying with, and for all the reasons, whatever, I think what came out of it is feeling like, well, they are doing all these extra things. Yes, you had to ask for it, but that might be the case in some situations, right? And going back and forth and really, and then Natasha helped us too with that.
Yes,
because her son was, she had more experience with the epithelioid sarcoma than I had. So, but yeah, I think, well, it's so great. We'll all be thinking about you tomorrow, and
thank you.
sending you all the positive energy and strength and all of that. And thank you so much for being here. I can't.
Thank you. I appreciate it.
Okay. All right. So Natasha's our token caregiver on our panel. Thank you for being here. So as a caregiver for your young son, did you weigh risks or conflicting medical opinions when making difficult decisions and choices in his care after his diagnosis?
Yeah, sure. Thank you so much. I'm super thrilled to be participating in this panel with you guys. And I just want to say thank you first and foremost for sharing your stories. I know that they're deeply meaningful and personal to each of you, and thank you for being vulnerable like that and sharing with us. So I appreciate all of you. Yeah, our 8-year-old son was diagnosed with epithelioid sarcoma in 2020. It's super rare, as FIDA is now learning. We were thrown into a world where decisions are complex and information is very scarce, and frankly, expert opinions don't always align. So over time, we've developed a process that helped us make these choices. And so a few of the things that we've done, I'll share with you here. First and foremost, we learned to ask the tough questions. And it's really important that you cannot be afraid to ask about things you don't understand, even if it means asking more than once. Like Julie said in the beginning, you are the CEO of your care, whether you like it or not. So, ask them things like, what's the goal of this recommendation? Is this based on sarcoma specific experience, or is this general oncologic protocol? I mean, I would even go so far as to ask, have you dealt with the same situation before? If yes, how did you handle it? Also, you've got to evaluate other types of risks besides just medical risks, right? So Elliot was recommended by his oncologist to do a thoracotomy without biopsy because he was at super high risk of a pneumothorax, which, his lower lung collapsing based on where there was a growth located on his lung. So they wanted us to go ahead with basically open chest surgery without even biopsying first. And that was really, really scary. We had to look at our option of this, not only through a medical lens, but also like a lived experience lens. Like, what's this going to look like for a now 12-year-old child, right? How is he going to be able to go to school with this? How is he going to be able to sleep at night with this? What is it going to require of us? So oftentimes we overlook these in the face of I have to make a medical decision for the best, of my son or the person I'm caring for, but it cannot be in a vacuum. Definitely we reached out for additional opinions. Like it's been said over and over again. And I'm so proud of FIDA for doing what she did because frankly, we have to make sure every single person who's diagnosed with a sarcoma sees a sarcoma specialist. That's it. Like end point blank, that's all. And Sarcoma Alliance was instrumental in helping us understand how to do this. Your doctor should never object to or be uncomfortable with you seeking a second opinion. And if they are, you need to find a new doctor. That's just it. But here's the bonus. Any specialist that you do consult for a second opinion, they're pretty much always open to remaining in communication with you and connecting with your primary care team. So now you've just given your care team a major glow up. Win-win, right? We need to prioritize flexibility, right? You have to choose a path that leaves room to adjust. So, for example, when they wanted to do that thoracotomy on Elliot, we know specifically with epithelioid sarcoma, it is very aggressive, but it also grows really slowly. So we knew that waiting another month while we reached out and got those additional opinions was a much lower risk than us deciding to just go ahead and barrel forward with the thoracotomy. Listen, if something feels off, then you need to trust your gut. You need to pause. You need to ask more questions. You need to use your intuition along with just the facts that are being put in front of you. And for those of us who are caregivers and not patients ourselves, I would say you must involve your patient appropriately. So we've always been honest with Elliot. He was 8, like we told him what was going on, but in the context that he was able to understand and process. But by doing that, it made him feel safe and respected. And over time, he's continued to weigh in more liberally on what we're doing next and what is important to him. So it's really helped protect his own autonomy. There's no perfect choice. There never will be. Your goal isn't always a perfect decision. It's the one that's right for you at the time. So I wanted to make 3 quick recommendations for caregivers. Number 1, keep a journal of the journey. track, and for you guys, patients as well, but specifically for caregivers, because you're that second set of ears and eyes, right? Track the conversations, track the changes, and track the questions, and keep a running narrative of what you've learned and discovered. And do it as soon as possible, like before you go to sleep that day, right? Because you'll be amazed at how much clarity that provides down the road. Spend time formulating questions and then ask them even if it feels uncomfortable. I was terrified of asking sarcoma specialists, how many cases of epithelioid sarcoma have you actually seen? But I did it even though my hands were shaking, right? It was nerve-wracking for me because I didn't want them to feel like I was challenging them, but context matters, and their hands-on experience was really important to me. And then lastly, set boundaries around your research, right? Rare disease can completely overwhelm you with uncertainty, and Dr. Google should not have a medical license, right? So give yourself permission to stop for the day when you need to, protect your bandwidth, and plug into support groups. And let the more experienced group members who have been in that group and been dealing with this sarcoma journey longer than you have guide you to more reliable and trustworthy insights. So those are my 3 tips for caregivers.
That's great. Thank you. I mean, I can relate to all of that. My son was 17 at his diagnosis, so I can only, and he's still like at 17, he felt like a little kid to me, you know, so I can't imagine an 8-year-old. Like I remember he had never been in a hospital before, you know. So anyway, thank you. That it's a great perspective and understanding that you have. I saw, we're going to kind of wrap up, but I saw one question in the chat. Let me just see. How do you decide who to get treatment from? I've obtained a second opinion and the treatment plans are slightly different. Whoever, you know, wants to chime in on this, you know.
If you don't mind, I'll just jump in real quick on that.
Yeah.
If the opinions are different, get a 3rd opinion, get a 4th opinion. Like keep asking until you see the common thread, until you're able to sift through what's being put in front of you and identify what makes sense for you.
Yeah, I think that's a hard thing because it's like a second opinion, but a 3rd, you know, and I think you're right. It's like there isn't just one set way to do things, right? It's based on the information you get. And if you're not feeling comfortable, it doesn't matter, you know. Does anyone else have any kind of things to add to that, or you're good? Okay, well, I don't know if there are any other questions in there, but we are going to, the panelists have said they, you know, would share their contact information. So we will make sure to send that out to you if anyone wants to connect with any of our panelists. I want to thank you all so much for sharing those stories and moments with us. As Natasha said, I know how hard that is. I mean, I'm holding back, and you know, my son is doing well, but it's a hard thing to talk about. And I know how meaningful this will be to, how meaningful it is to the people here today, and then the people who will be able to catch the recording, because I know not everyone could be here live today. So on that note, I wanted to, that concludes our 8th annual Sarcoma Exchange. I can't believe it. I want to take this opportunity to thank, of course, the Sarcoma Alliance, Wendy Walk, and then our sponsors. I'm going to say it right. Genetech, I hope I did that right. Ipsen and Adaptimmune, all of our speakers, our panelists on our patient caregiver panel, and all of the attendees. And a big thank you, super big, goes out to Julie Johnson and Tim Opsahl for all of their work on this event. You'll all be receiving a survey later this evening, and truly your opinions are so important to us and so valued. So in order to keep improving the exchange, we truly appreciate if you could fill out that survey. And volunteer events like this, they happen because of special people like we see today who give of their time. So if you're interested in being involved for next year, please email info@sarcomaalliance.org, and we'll also, you know, we'll get that email to you at that address to you if you need that again, to request more information about different volunteering opportunities. And as you can see, you don't have to be a patient. I'm a parent. And then the Sarcoma Alliance YouTube channel. I think we could go to the next slide, I think. Is there another slide that, or maybe there, no? Okay. Maybe that was earlier. Okay, never mind. There's Sarcoma Alliance YouTube channel. I think we had that early, and we'll have edited sessions posted, and all of you and anyone who registered for this event will receive a link once that's uploaded and available to view. And then just a reminder to feel free anytime to head to the Sarcoma Alliance website for resources. They have amazing resources. And then, of course, to me, as a patient care coordinator for an organization called Wendy Walk, I offer resources and support. So please reach out anytime, and that you can reach out. As you know, I connected through Facebook with people, Instagram, my email, which is meredith@wendywalk.org. But when we send out information, we'll make sure we send out the different emails if you want to connect with any of the patients, caregivers, etc. So, like I mentioned, I'm a parent of a sarcoma patient. My son Julian was diagnosed with sarcoma in the palm of his hand when he was 17. He's now 26. And I've seen such a huge change in him in those 9 years. It started out with my husband and I being the main advocates for him on his behalf. And through those years, he's found his own voice. And this theme this year that Julie came up with feels especially meaningful to me for that reason. And today we discussed advocacy and topics of pathology and radiology. And as we've noted, it's like pathologists and radiologists are not specialists that we often have connection to in the way we do with our oncologists and our other physicians. So it was really great to hear from them. And I hope those were very insightful for you. And I know just learning about the meaning of advocacy and how to use AI and all of these things, I know I learned so much that I'll be able to share with the patients that I connect with. So one final thank you, and I truly hope this was a meaningful and beneficial experience for all of you, and beyond all, that you walk away with some tools to make you the best advocate. And as Julie's doctor said, the CEO of your care, or for those of your loved ones. Take good care and enjoy the rest of your Sunday. Thank you so much for being here. Oh yeah, we're going to play the videos that we weren't able to play earlier. Thank you so much for being here, everyone. Thanks.
The fight against cancer is universal. Each patient journey is personal. Personal in its impact, and now personal in its care. At Adaptimmune, we're pioneering a new approach, one built around engineering a patient's own T cells to recognize and attack cancer cells, and changing the way solid tumors are treated in a single dose. This approach has made us a leader in cell therapies and brought forth the first FDA approval of an engineered cell therapy for a solid tumor cancer. And we're just getting started. We believe the most potent weapon in the fight against cancer is the power of each person. Our personal commitment is to advance a robust pipeline of cell therapies to fundamentally redefine the future of cancer treatment, a future filled with more treasured personal moments. While the fight against cancer is universal.
On behalf of Ipsen, I am thrilled to be joining you all for the Sarcoma Exchange. We are proud to support the Sarcoma Alliance, and we recognize the meaningful difference they are making for people living with sarcoma. Educational events like this are paramount to learn from one another and see what the future holds as the understanding of subtypes improves and research leads to improved outcomes. As a global biopharmaceutical company focused on bringing innovative medicines to people living with cancer, neurological conditions, and rare diseases, we too believe in the importance of improving care and outcomes. One area that we are especially passionate about is epithelioid sarcoma. We are the makers of Tazverik, tazemetostat, the only FDA-approved prescription medicine used to treat adults and children aged 16 years and older with epithelioid sarcoma that has spread or grown and cannot be removed by surgery. The approval of Tazverik in these patients is based on a study that measured the percentage of patients whose tumor shrank or disappeared after treatment and how long that response lasted. Tazverik is still being studied to confirm these benefits. From all of us at Ipsen, we hope this is a great exchange and that it gives you the opportunity to get to know others in this community and learn even more about sarcoma. There is important information to know about Tazverik. Tazverik can cause serious side effects, including the risk of new cancers. It is not known if Tazverik is safe and effective in children less than 16 years of age. Before taking Tazverik, tell your healthcare provider if you are pregnant or plan to become pregnant, or if you are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, and before starting any new medications or supplements. When taking Tazverik, avoid eating grapefruit or drinking grapefruit juice, and avoid taking St. John's wort. The most common side effects include pain, tiredness, nausea, decreased appetite, vomiting, and constipation. Call your doctor for medical advice about side effects. Report side effects to Ipsen Biopharmaceuticals Inc. or FDA. Please see full prescribing information, including medication guide, on Tazverik.com. On behalf
When we ask questions, we make sure they are the big ones. Questions that challenge our industry. Questions that push the boundaries of science. Questions that take us beyond our labs. There's a reason our work has a bigger impact. We ask bigger questions.
For those of you that are still around, we just want to send one more quick thank you to all of you in the audience who participated today in your asking wonderful questions, just being present and listening to the various panelists. Also, thank you to everyone who had a hand in bringing this to life, those on the content team, and our speakers and our peer panelists. We just really appreciate all of the effort that you put into today. And just in closing, again, as Meredith said, Tim, if you want to flip to the next slide real quick. As Meredith said, there are a few things coming your way. There will be a survey sent to you. I would encourage you to please, I know you've given a lot of your time today, but if we could get a couple more minutes of your time just to react to the content that you saw today. Your input will help direct future exchanges. So it's very important that we understand your reactions to what you saw today. And also, if you would like to be involved in helping with anything we do at the exchange, anything we do at the Alliance, including the exchange, just send an email to info@sarcomaalliance.org. And then lastly, again, you will get an email in the next few weeks with a link to the presentations that will be on our YouTube channel, and you can go ahead and view those again at your convenience. So we just want to thank everyone again for attending, and have a nice remainder of your Sunday.